We want to reassure patients and their families and anyone concerned about cancer that the hospital is open and we are continuing to treat patients. We are aiming to keep the footfall of the hospital as low as possible in order to keep our patients and our staff safe. We understand for patients who have to come to the hospital that this can cause anxiety. We'd like to reassure you that we are observing social distancing and that all staff are trained in infection prevention methods. For patients who do have COVID-19, they'll be nursed in separate rooms in isolated areas of the hospital. Some patients will find that your treatment has been put on hold. And I'd like to reassure you that we have your best interest at heart and we're doing everything we can to assess the risk versus the benefit of continuing treatment or delaying treatment until the worst of the COVID pandemic has passed. We are now planning how to phase the recovery to business as usual as soon as it is safe to do so. Anyone who is not currently a patient and has symptoms or is worried that they may have cancer, please see your GP, as it is important to diagnose cancer early. If we do this, we have a better chance of curing it.
The Adult Psychological Support Service is still very much up and running at the Royal Marsden. We're here for patients. If you're a current patient of the hospital and you feel that you would benefit from our services, then please do ask your doctor, your clinical nurse specialist, or any other member of the team that you're in touch with to make a referral to us. Currently, we're offering our service via the telephone, so you won't have to come into the hospital. We're also taking care of the staff at the Royal Marsden at this time so they can continue to deliver the best possible care to patients at this challenging time. We're offering them drop-in sessions, the staff counselling service. They have a telephone helpline that they can call. We're also taking care of their physical needs by providing them with food and treats and care packages so they can look after themselves.
The hospital is open and we are here for you. If you are feeling unwell and you are on treatment, contact the Royal Marsden hotline and we will decide if you need an assessment. If you have any questions about your treatment, contact your clinical nurse specialist. We are keeping footfall as low as possible to keep patients and staff safe. This has meant restricting visiting to only exceptional circumstances for the time being. Some patients are having remote appointments via phone or video call. This saves them having to come into hospital. Some patients are being supported to have treatments at home. The Royal Marsden Cancer Charity has provided Wi-Fi boosters and iPads to help patients keep in touch with their friends and family while in hospital.
In the radiotherapy department, we're operating a nearly normal service and expect to continue to do so for our radiotherapy patients. We're fortunate that we have a modern, spacious department that we can support patients to socially distance themselves whilst they're in the department. We've spread appointments out during the day on all of our treatment machines, and this supports an efficient delivery of the service so patients are coming in, being treated, and leaving as quickly as possible. Some of our patients are able to have their radiotherapy and fewer treatments with the same outcome. This avoids unnecessary visits to the hospital. Our radiographers are displaying their usual calm professionalism and are in regular communications with our patients. All our radiotherapy patients can contact their treatment teams directly at any point in time if they have any questions or concerns.
We're all feeling a loss of control at the moment, but it's even harder when you're in lockdown and you can't leave your house. So it's about thinking about the things we can have control over, what we wear, when we have our meals, when we're going to talk to our loved ones and our friends, what we're going to watch on the television. Taking back that little bit of control can also be helpful in terms of setting a routine each day. So when we get up in the morning, it's not just a vast empty space, but we know what's going to happen. And our last tip is to be kind to yourself. You will be feeling anxious, we're guessing. And it's about recognising that that's a shared response of other people and not getting cross with yourself in respect to that, but talking about those anxious feelings with those around you.
We hope you are coping well in these difficult times, and we hope to see you soon.